Hello everyone, this is Dr. Hawk from Center of Integrative Medicine. Today I'd like to talk about sex drive. A lot of people suffering with a low libido, sex drive issue and sexual dysfunction, and especially female are suffering with low libido. So a lot of my patients come with it, and they come with especially for the man, they've been taking sildenafil for a long time and no improvement. So or they enjoy the time they take, but once they stop it, they again don't feel any more desire. So a lot of people are told that they are suffering with a low libido sex drive issue because this is their mental or psychological disease, which is not. Science doesn't tell that. Science shows that whenever you making your high T, good number of T testosterone hormone, you need to have a low cortisol. Otherwise, pregnenolone, precursor of the testosterone, is going to make low cortisol instead of making more testosterone that you need. But testosterone is not always connected to the libido either. A lot of people come with a very good testosterone profile, but they have a libido issue. So what is the root cause actually? And then what is the permanent solution? Instead of taking sex therapy, Viagra, this and that, that's not a solution. So what do you have to do? So you have to go the root. So if I tell you the top 5 root cause of the sex drive libido issue, number 1 is inflammation. If you have inflammation in your pineal vessel, you cannot make your blood flow 100 times more than normal during the sex drive. So you have inflammation throughout the body as well as your pineal vessel. To improve the anti-inflammatory activities, antioxidant, and you have to go anti-inflammatory food, you have to do exercise, you have to have a mental happiness, you have to do relaxation, breathing techniques, all things you have to apply to lower the inflammation. Number 2 is a endothelial dysfunction. If you have any types of cell damage issues, so endothelial cell in the pineal vessel is not working properly, so you definitely will be suffering with some type of sexual dysfunction. So you have to have enough nutrient in your diet. You have to have a plant-based diet, so you get a phytonutrient, phytochemical that helps your endothelial function well. You produce enough nitric acid, and blood flow is good on your pineal vessel, and endothelial cell in the vein is working properly in the penis. Number 3 is a chronic disease. A lot of patients come with a libido issue, and research showing same thing. If you are suffering low libido sexual dysfunction, you have a chronic disease. Why don't you fix that first? Maybe your libido is coming from that chronic disease, especially metabolic disease like a high blood pressure, diabetes, and cancer, some type of autoimmune disease and heart disease issues. Because before you got this disease, your sex drive was fine. Now you're struggling with that. Just fix those diseases, then it's gonna be normal. If not a normal, you have something to do. We have a lot of solution. Patients, I saw many patients, they are enjoying their life with just naturally fixing their sex drive issue. So fix your metabolic disease first. Number 4 is insulin resistance. A lot of people are overweight, have an insulin resistance problem. So make sure you don't eat food that raising your insulin high. So what are those food? Processed food, plain rice and wheat and dairy milk. So avoid those food who is causing high insulin. You take a plant-based diet, like lots of plants and healthy fat, low carb will help you get rid of insulin resistance problem. And number 5 is stress. If you have adrenal dysfunction, you are going to be struggling with a sex drive because you making high cortisol instead of high testosterone. So you have to have a proper procedure, proper balance of your using your pregnenolone to convert into T testosterone, not the cortisol high. So you have to balance your stress by exercise, your good sleep, natural herbs. I have a video on each health problem. You can watch those video, how to lower the stress, how to lower the insulin resistance, how to improve the endothelial function, how to get rid of all those diseases. Then you can slowly get rid of your libido issue, sex drive issue. So and then finally I would say inflammation, your endothelial cell dysfunction, nitric cell production barrier, chronic metabolic disease, insulin resistance, and stress situation. These 5 root cause you focus, and you will get rid of your libido problem. Okay, and if it still doesn't work, go to our Amazon store. You can get all kind of natural approach you can do. So to improve your sex drive, if you go if your diet doesn't work, you have to go supplement. And supplement is needed a lot of time because your body is not producing enough enzyme to process your food into the DHEA or pregnenolone, or lower the inflammation. So you have to get food healthy, and then you have to get supplement to function your system better. What is the function? First of all, a lot of people have a very low energy. Support your body with energy. I have energy details support in here, and then if you are struggling with a anxiety, stress, have a Tranquil Plus. It has a nervous system support, it has a adrenal support and digestion support. Okay, if you have a really digestion problem, you have to put some enzyme. You need betaine hydrochloride, papain, amylase, protease, lipase, all types of food support enzyme. And if you have a gut issue, then you need some good probiotic. It's a whole probiotic, all blend of probiotics are here. And if you have a any types of mineral deficiency, a lot of men are suffering with mineral deficiency. For them, multi-mineral would be a good option. And a lot of people have a anger issue, couldn't sleep, and weak and fatigue. They need detox. You need to have a complete detox your body. So complete detox your body would be the good way to get rid of the all type of toxin of the body. And after fixing the foundation, any disease, you have to fix your physical and emotional and psychological problem. Then come back with a specific natural medicine that you need. This one you need for foundation. You have to healthy diet. Then you have to go to the balancing hormones. So this will help you to balance hormone, and then if you have a specifically libido issue, these two are masterpiece for you. So these two are the masterpiece for you if you have a low libido sex drive issue. So this is a Peruvian matcha. Is quickly lower the inflammation, produce nitric oxide, and improve the flow in the pineal vessel. And then this one is gonna be quickly making your T high, testosterone high. A lot of patients saying that, Dr. Hawk, we have been taking pregnenolone 100 milligram, but only 10 milligram I got my sex drive back. Yes, because it's a right medicine, and it's a right natural supplement medicine. And then if you have a lot of time have a fatigue, tired, anxiety because of low zinc, so get some zinc. So if you get this vitality, and this you can take two twice a day, and then this is zinc only twice a day, and energy code 2 twice a day, and you can take all of them in a empty stomach, except digest optimizer. Digest optimizer you take with your meal, because that's you digesting food. Other than that, everything you take away from your food. Okay, and then that's how you improve your men libido sex drive problem. For the female, same thing on the basic wise, because foundation is same for male and female. Inflammation, stress, chronic disease, metabolic problem, and insulin resistance problem, those are same for everyone. But for female specifically, low libido sex drive problem come from their low progesterone, high testosterone, high estrogen, and high cortisol issue. So if you have a complete hormone, because complete hormone for men and women both, to improve their right hormone balance. Okay, this is for both can take, so female can take it too, but this female care specifically for female, because this is herbs, this is not for men, this is for female to improve their progesterone level. So these together will improve the progesterone level for the female. And of course they have to do basic foundations, like a digestion issue, I said, liver detox, probiotics, and improve energy. And then if you need mineral support, you can do that. All together you can get rid of libido issue. And if you really struggling for a long time and you messed up your sex drive with a sildenafil, you need stem cell to grow your testicle back to normal. So stem cell is the last resort if you can afford, and if you are able to do that. And stem cell, a lot of people do a 100% guarantee that you'll get back your sex drive, but in America we don't do that. We say that it improve your body function, and definitely will help you any problem you have, right? It could be your sex drive, it could be your liver function, heart function, anything and everything. Anyway, let me know if you have any question. I hope after that video you'll have no more question on a sex drive for female and male both. But if you have a question, I'll make next video for you based on your queries. Thank you so much, Dr. Haq again. I'll come back to you in the next video. Thank you. Bye.